Hi there, Dr. Love here from the Kirkland Spine and Posture Center. Today I want to talk about back pain. Back pain is most often chronic, meaning that it comes and goes. And of course, it is often worse in the morning time. Back pain is most often caused by poor spinal alignment and specifically poor spinal alignment over the course of time. If our spine's out of alignment, it's under a lot more stress and strain. And then what happens is those tissues become inflamed, they become sore, painful, and we get inflammation, and of course we get stiffness as well. And I wanted to give you a little demonstration of how this might actually occur. So we have here's the spine model, okay? Now, if the spine is straight, okay, and I put pressure down on the spine, and I'm going to put a lot of pressure down, okay, a lot of pressure, and I've done this in other videos, and I'm literally turning red, and you can see that that is amazingly strong. So when the spine's lined up properly, and when we're looking at it from the front, it's straight, okay, just like that, then the spine will move better, will function better, will stay healthy much longer, and should be fairly pain-free. If we see the spine is actually bent to the side, let's say like this, okay? And a lot of people have some level of bending to the spine. It could be a mild level of scoliosis. Scoliosis is the term that we use for the spine when it is actually bent over to the side, okay? Now, if we see the spine is actually bent to the side, now let me put pressure down on the top, and it folds immediately, just like that, okay? So what I'm showing you here is then when we have these little bends to the side like this, and that's one of the things that we assess in our office, and we will use various technologies, including the Polestar system, computer analysis and adjusting system, as well as X-ray and other types of technology to analyze the spine. Those little bends in the spine will cause additional stress and strain in the spine, weaken the spine, as you can see, no force at all, and it bends over. And over time, it just gets worse and worse and worse unless it's actually corrected, okay? So what can we do to actually treat let's say, the back pain, okay? What is often used to treat back pain? Well, we can use dangerous drugs that, of course, they're only going to treat the symptoms. And then what happens with that is that over time, we wind up getting worse and worse. And that's no good. You can exercise, you can get massage, you can see a physical therapist, things like that, and other types of therapies to the soft tissues, the muscles, things like that. And they're appropriate and they work at certain times, but they're not actually going to fix the misalignments that might be causing the back pain in the first place. Okay, and of course, those things I want to mention will only give you, they're symptomatic, they only give you temporary relief. So one of the other options you can do is you can actually see a chiropractor that specializes in assessing and fixing these misalignments. Someone that can actually follow the progress, and that's something that we do in our office. We take x-rays and we will follow the progress and actually show and prove that the spine is actually changing and create a permanent fix and correct the actual problem and the cause of the problem itself. So I want you to ask yourself, which is the appropriate way to actually fix the problem. Do you want to treat the symptoms, just get temporary relief, or find the cause of the problem and hopefully fix it? So ask yourself that question: which is the right way that you think, and what makes the most sense to you? Hopefully you've liked what you've heard and it's made sense to you. If you're having a problem, then please give us a call and let's see together if we can help you. You can call the number on the screen or click on the link on the screen as well. And hopefully we can, again, see if we can help you, okay? Thanks for watching. Appreciate it, and have a great day. Take care.